Hi, I'm Jirka. I'm a Hematology Oncology Fellow in Los Angeles, California, and today I'm introducing ONCOassist's Advanced Myelofibrosis tool. Myelofibrosis is a rare and challenging hematologic disorder to manage due to the complexity and significant disease heterogeneity. Over the past few decades, multiple prognostic scoring systems have been developed, with the first being the International Prognostic Scoring System, or IPSS. Following the IPSS, several other tools have been created, and this has made risk determination even more complex. And for a clinician who does not see a high volume of myelofibrosis, this can make it rather confusing, knowing which score to use, what information is needed for each score, and how to interpret their results. ONCOassist has created a tool that provides an output for all 5 of the major prognostic scores, after providing answers to various patient characteristics in the form of 12 simple questions, only taking 60 to 90 seconds to complete, which for me is a drastic decrease in the time needed to obtain this information, as I was previously searching through multiple different resources to find the various tools, and then not to mention the additional time needed to find the answers regarding some of the nuanced questions, such as, is the patient's karyotype unfavorable? On the ONCOassist tool, all of that information is very easy to obtain. There's an info bubble next to these sorts of questions that detail the information that you need without leaving the app. Once all the information is input, you are provided with the risk assessments based on the IPSS, which is typically used at the time of diagnosis, along with the dynamic IPSS used throughout the patient's entire treatment course, and the DIPS Plus, which incorporates the karyotype. You are also given the mutation-enhanced IPSS, which is the MIP70 and the MIP70 Plus, which are more helpful when considering transplant-eligible patients. Seeing the concordance or discordance between all of these scores can be somewhat overwhelming, but this is a real-life challenge when dealing with myelofibrosis. But being able to see the scores presented side by side makes it easy to switch between the results and find what aspects of their disease are impacting their survival the most, which is rather helpful. At the end of the day, these prognostic tools help frame the discussion for how aggressive a patient's myelofibrosis is behaving, predicting the survival, and determining what therapies may be most impactful in treating their disease. And if your patient is transplant eligible, all of this information is critical in helping frame the discussion when talking with the transplant team. In my practice, the ONCOassist myelofibrosis tool has not only been a significant time saver, but has also improved my confidence in providing patients with better treatment decisions and helps me empower them by helping them better understand why we are choosing to approach their disease in a certain way, and by showing them the Kaplan-Meier curves based on their scores during their clinic visit. I would certainly recommend utilizing this tool for any myelofibrosis patient you encounter and showing the results to your patients to help them better conceptualize your treatment decisions. Thank you.